From one of the main prisons, Sedena prison, also known as the human slaughterhouse. Well, we can speak now to Dr. Reem Alkasem, a pediatric care doctor at a hospital in Idlib, who says she's treated prisoners who were held at the prison. Thank you so much, Doctor, for joining us here on the program. You've documented and told us about some of the horrors that you have seen, some of the young children that you've actually treated who've come out of this prison.
Yes, hello. Hello, Miss Hilda. I'm Dr. Reem Alkasem from Idlib. I have been working in SKT Hospital for 10 years. In the northwest of Syria. After 27th of November, we received a large number of children and women that have injuries because of war. That is due to the bombing of hospitals in Idlib and Aleppo. That make very big suffering for our hospital, that we don't have much medicine and medical equipment that we can receive them. Also, today
you received some of those young prisoners. Just tell me what you saw and what you had to treat.
Today we received 3 detainees from Palestine security branch in Damascus. One of them, elderly man, that have 55 years. He suffered from renal failure, anemia, fractures in lower limb, wounds in his back, and soft tissue injuries because of long beating and abuse. This elderly man have mental confusion and physically disorder, confusion, anxiety, depression. He also suffered from feeding problems, weakness. He can't talk. He has skin infectious disease such as lice, scabies. Second young man, he has 23 years. He has been detained from 4 years. But he has wrist injuries, wounds, fracture, neck injuries, head trauma, that he has Racon sign that refers to long beating. He has also burners with fire.
Yes, and Dr. Reem, you also had a young patient who had been kept in the dark in solitary confinement. Can you just give us a little bit more detail about him? Because he found it very difficult to have any human contact.
Third young man, 20 years old, he has been detained for 5 years. He suffered from asthma and cough and fever and skin infections. He has severe wounds in his back and his arms. He suffered from mental confusion and depression, severe depression and anxiety. He was anxiety of anything.
Yeah, I understand. And you were in the briefing notes that you gave. You talked about the fact that the anxiety, the depression comes from him being in the dark space, not being able to cope in the light, spending a lot of time in the dark in solitary confinement. Dr. Reem, we're grateful for your time. Thank you very much for joining us.
much.